Okay, so hello everyone. My name is Autumn. I am a project manager for the Canadian Coalition for Green Healthcare, and on behalf of the coalition, the Canadian Association of Nurses for the Environment, and the Ontario Nurses for the Environment, I would like to welcome you to our second Nursing Week event. Health Equity Starts Here, Environmental Justice Through a Nursing Lens. As I said, this is the second event of our Nursing Week series. We have three more this week, which is really exciting. If you haven't seen those, haven't registered for them, I'll put a link in the chat so you can check out the other events. But I'm really excited for this one today. So I just want to share a few technical things before I hand things off to our presenters. So throughout the event, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering the questions at the end of the event today. This webinar is also being recorded, and the recording will be sent to all registrants and be available on our website and YouTube channel at a later time. I will probably be sending out that recording at the end of this week with all the recordings of all the Nursing Week events. So don't feel bad if you miss one or you can't attend one that you wanted to be at. You will get those recordings. So I'm now going to hand things off to June Kaminski to start things off. Thanks.
Welcome, everyone. We're so excited to be presenting this topic to you on health equity and environmental justice. My name is June Kaminski. My pronouns are she and her, and I'm here with my wonderful colleagues, Alysha and Ankur, and we are all members of CANE. We're so appreciative of Coalition, CANE, and ONE for giving us this opportunity to share our stories with you and work with you today. And we're grateful for everyone for inviting us into this space. Next slide, please.
Awesome.
We just wanted to say that we have no disclosures. Next slide, please. And now, before we go further into our content, we would like everyone on this call to take a pause, take a moment, and reflect on the Indigenous lands in which you're currently residing on. If you're unsure about which Indigenous lands you are on, you can look at this nativelands.ca resource. There's a QR code that you can scan that can lead you to it. Depending on where you are in the globe, this may or may not bring up information for you. But the three of us are currently living in different parts of British Columbia on the west coast of Canada, which is essentially a settler colonial state where we reside on colonized Indigenous lands. And we acknowledge that Canada was founded on land dispossession, land expropriation, genocide, and the repression of Indigenous and Black people. And as a result of ongoing colonization and structural disparities, this has positioned Indigenous, Black, racialized, and other equity-denied groups, put them at an inherent disadvantage, impacting their health and their well-being. So we would like to take the time right now to acknowledge the treaty and ancestral lands of Indigenous peoples across Turtle Island, which is Canada is a part of, to counteract the unjust eraser of Indigenous peoples' land ownership, governance, stewardship, and surviving cultural traditions. We'd like to affirm the need for decolonization, and it's wonderful to see that healthcare is moving in this direction across our nation, and to uphold Indigenous rights and sovereignty in every aspect of our lives. So with that, I would like to acknowledge that I am a nurse. I've been a nurse for 41 years, strongly in nursing education over the last couple of decades, and I'm currently working for the Coalition as a project coordinator for their implementation readiness project, which is reducing carbon emissions, etc., to net zero in healthcare buildings. On a personal note, on my father's side, I'm seventh generation Scottish. And on my mother's side, I'm 14th generation French immigrant to what then was called New France, and who also intermarried with Anishinaabeg lineage, which is basically from Garden River near Sault Ste. Marie, Ontario. So I was born at what I consider the nexus of the Great Lakes, right where Lake Superior joins Lake Huron, and it's just above where Lake Michigan starts. I grew up on a little tiny island called St. Joseph Island. But now I am currently living on the unceded territory of the Squamish, Musqueam, and Tsleil-Waututh nations in what is now called West Vancouver, which is a lovely little village town, which is becoming a city, but we still hesitate to call ourselves a city, nestled in the North Shore coastal mountains beside the Pacific Ocean. And there's a little picture of that in the upper right. So I pass it on to Alysha and Ankur to situate themselves.
Sure. Thank you, June. I can go ahead. Just really appreciate sharing about yourself, and it's lovely to hear about. So hi, everyone. My name is Alysha. My pronouns are she, her, and I am speaking to you today from the territory of the Sauk-Antchiano Nations. This is a place now called Southern Vancouver Island. On the image that you see on the screen, that left-hand picture is the Souk Basin. So this is an incredibly ecologically rich home of seals and sea otters and sea lions and eelgrass and all kinds of other than human creatures that the Sauk Nation in particular has stewarded since time immemorial. I am a white settler person. I am a second generation white settler on my maternal lineage. Paternal lineage is unknown. However, I have done ancestry DNA, which has illustrated a connection to Northern Europe. So, I come into this space in speaking about environmental justice and health equity as someone who does not have lived experience, nor does my own family or community. And so I just want to acknowledge that because there's a tension there. I'm speaking about and seeking to be in solidarity with experiences that I won't have. And so I just want to acknowledge that. I feel like it's pretty important to say. And just in line with June, strong commitment to uplifting Indigenous knowledges in this space and decolonial perspectives. So that's really what we're aiming for with the work that we're doing around environmental justice at CANE.
Thanks for that wonderful introduction, Alysha, and especially to you as well, June. Such a prominent point to start our work off on. To situate myself, I'm coming in from the unceded and ancestral territory of the Haisla Nation, colonially known as Kitimat, BC. My name is Ankur Patel, and I'm a new grad nurse, actually. So just joining in on the field myself, and a very proud CANE member. I've had the opportunity to engage with CANE in very many circumstances and have been extremely privileged to have done so as a student. So I'll kick off the session a little bit here, but I really want to thank everyone for being here today. If you guys have a moment, could you drop your land acknowledgements in chat and perhaps which province you're from as well? That way we can get a strong picture of who we're talking to today and what context to bring in as we go along. If I can advance the slide here, we'll dig into some of the learning objectives for our session.
Sounds good, Ankur. Thank you. So also just to piggyback on what Ankur was saying, we'd also love to know what kind of nursing you might do. So whether you're a practicing nurse, maybe in community health or in hospital, if you're in nursing education, maybe you're involved in research, maybe you're a student, we would love to know that as well. So here are some learning objectives for this session. Really, to boil it down, we'd love you to have a bit of a clear understanding, maybe some, scaffolding on what you already know about environmental racism and environmental and climate justice. But we'd love you to walk away with maybe a bit of a clearer understanding, a sense of the health impacts of environmental racism, and a sense of maybe what could be some of the roles of nurses within this space. How can we address environmental racism? How do we promote environmental and climate justice in the work we do? Which it very much feels like the education and the advocacy space. But so we'll share throughout the presentation, unpack some of these concepts, and then provide various case studies and examples of environmental justice cases, and then what nurses have done in those contexts. And then particularly, we'll talk about a course that some folks might already be familiar with, This is an introduction to environmental racism created by the Canadian Association of Nurses for the Environment. So we'll talk a little bit about that. And Ankur will share some experiences of his own actually working in this space. So we hope that will bring forward these issues to you and maybe, compel your own work in this space. Okay, next slide, please. Thanks. I've got a bit of a rogue desk right now. It keeps moving around on me. Okay, so we wanted to say, please step away from the screen if you need to. Please step away from the conversation and the content if you need to. We want to acknowledge this is difficult and painful content. We are talking about violence. We're talking about severe harm to people. In some case, harm that kills people. This is structural racism. This is severe injustice. And for some folks, they might personally have experienced, their communities, their families may have experienced environmental racism or environmental and climate injustice. So we want to name that and just say, well, this is critical information to learn about and to look at. It's also hard to hear about and can provoke grief. And so we want folks to step away, take care of yourself. Whatever you need to do in this space is very welcome. On that note, there's some really good research supporting gratitude as a wonderful practice for buoying the heart. There's some really good neuroscience behind gratitude as a practice. And so before we get into some of the didactic content, looking at these concepts and cases, we'd love to invite you to connect with a sense of gratitude at this moment for this day. So that can be, a warm cup of coffee or tea this morning, a matched pair of socks, whatever it may be. We would love you to pop into the chat a sense of gratitude that you might have right now. And you're very welcome to just take a moment, feel your feet on the ground or your bum in the chair and settle in and connect with that sense of gratitude that you might have for this day. So yes, thoughts are welcome in the chat.
If I could perhaps speak to something I'm grateful for today, it is a beautifully cloudy day on Hassel territory, and that means we look like we're about to get raining soon. And I was hoping to start a new compost pile in our backyard, so we need to create a little micro environment. So hopefully the critters are out and about crawling, and we can create a little compost system today.
Nice, Ankur. That's awesome.
Yeah.
Yes, I'm on the first sips of coffee myself as well, and being able to watch this webinar. Thank you so much, folks. That's great. And then gardens. Aggie talks about veggies in the garden, melting snow coming from a snowy place. That's awesome. Thank you, folks. And some sunshine, of course. That always buoys the heart and brightens the mind. Okay, that's wonderful. Thank you. Thank you for sharing that, folks. Okay, so let's get into a bit of the didactic content here. So the topic of today's session is on environmental justice and health equity. But we can't talk about environmental justice unless we first talk about that which patterns environmental and climate injustice. So to do that, I wanted to share a bit about my own experience coming to this topic. So some years ago now, about 7 years ago, I had started a master's degree at the University of Northern BC. And I had stumbled across nurses' work, American nurses, actually, and their work on environmental justice. And it was, oh, wow, this is such an interesting topic. particularly Dr. Jess Leclerc's. She has a scoping review from 2019 focused on nursing strategies for environmental justice. And so I started digging into that literature and came across more of it. And American nurse scholars are really leading the way in environmental justice stuff. And I brought it to my nursing instructor and supervisor at the time. And she said to me, I don't understand the connection between environmental injustice and health. Why is this a concern for nurses? How is this relevant for nurses? And so I did a literature review on the topic because I wondered the same. Okay, how can I make this this connection clear? What is it about environmental justice that is relevant for nurses to know and to act on? And so in that searching, what came to light again and again was that the link between environmental justice and health is really racism. Racism is the force and the structure that creates health inequities. And this might be very clear to you already in your work. So numerous studies demonstrate that racism is the strongest predictor and exposure and proximity to environmental hazards. Environmental racism has been called an old but new version of deep-seated structural and systemic racism that is inscribed in environmental policy making and governance. So very along the structural determinants of health here, of course. So Black, Indigenous, and other racialized communities are made vulnerable to environmental hazards, not only because of those hazards, but also because systemic racism undermines health and the social determinants of health in all domains already. Next slide, please. So here's a definition from Dr. Ingrid Waldron. She's really an incredible leader in environmental racism and environmental justice scholarship and research in the country. And so she says, environmental racism is the systemic and institutionalized practice of citing hazardous facilities such as toxic waste sites and polluting industries disproportionately in or near Indigenous, Black, and other racialized communities. So in Canada, this looks like toxic waste sites, landfills, polluting industries of various kinds, mines, refineries, unsafe water systems or polluted river systems that are located in or near communities that already face the ongoing impacts of colonialism and racism. So when we say that environmental racism is systemic and institutionalized, we mean that these patterns are produced over time through law, policies, planning decisions, and unequal political power, meaning that some people are excluded from the decision-making and governance spaces. In the Canadian context, this is tied to colonialism and land dispossession in particular. For example, many Indigenous communities historically have had little power over decisions about industrial development in or around their territories. Institutionalized also means that these inequities become normalized and sort of the water that we're swimming in, just like settler colonialism, such that the Canadian government and the Canadian legal system, those are the institutions which these patterns are normalized within. But then it appears as though these kinds of environmental harms are normal. It's just part of doing business. It's part of the everyday thing, as opposed to something that is actually structured on systemic racism and colonialism and their decisions that are made by humans and certain groups of humans. So as a result of these structural phenomena, environmental racism downstream impacts health in all kinds of ways. Access to clean water, safe water, and housing, access to traditional food systems and safe traditional foods, connection to land. Environmental racism is associated with multiple health impacts. And of course, there's more research going on about this now, especially in Canada. And these include intergenerational trauma, mental health impacts, higher rates of some cancers, respiratory and reproductive conditions, amongst many other impacts. Next slide, please. So this is, you might have seen this before. This is from Eco Justice, which is a big environmental law nonprofit in Canada. And this is based on the work of the Enrich project. So this is a project led by Dr. Ingrid Waldron, who I mentioned before. And so the work that the Enrich project has done in Nova Scotia, this is a map of Nova Scotia, is really to map out Mi'kmaq communities and African or Black Nova Scotian communities vis-a-vis toxic facility sites. So those could be dumps and landfills and paper and pulp mills. And so if you take a look at this map, what you see is essentially the co-location of these toxic sites with Mi'kmaq, First Nations, and Black African Nova Scotian communities. So it's quite striking when you actually see it visually in this way. And it's hard to deny that there's a pattern that has occurred here. It's really important to say that the reason this research started in Nova Scotia was because of local community members from Black communities, and also the Pictou Landing First Nation Women's Association. So these folks in these communities have always been resisting this and drawing attention. And then finally, others coming around to rally and join in solidarity with research and more knowledge mobilization and so on. Next slide, please. Another striking example of environmental racism in Canada is the Aamjiwnayn First Nation. You might be familiar with the case of the Aamjiwnayn First Nation. So this is an Anishinaabe community that's located in Sarnia, Ontario, bordered by the most intense petrochemical concentration in Canada. And probably, that it could be challenged from anywhere in the world, really. There are 60 industrial facilities within this area known as Chemical Valley. The community, as a result, faces severe environmental health and safety risks from higher levels of air pollutants, including benzene, which is a cancer-causing chemical caused by the production of plastics, leading to declared states of emergency in the community at times when benzene levels get, are too high, and community members are sometimes become quite ill and need to be hospitalized. So community members in Aamjiwnayn have spoken quite clearly about the health impacts on them and their communities, including elevated rates of skin, digestive, cardiorespiratory, reproductive, nervous system, and autoimmune diseases. There's a book, in fact, written about this by a prof from the University of Victoria, all about the experience of Aamjiwnayn people and environmental racism. Next slide, please. At the same time, just like with the Pictou Landing First Nations Women's Association, it's really important to uphold the work that Aamjiwnayn First Nation community members, including one of their counselors, Janelle Namabin, have done to resist this. So Aamjiwnayn have been really leaders in calling for a global plastics treaty. They've been really involved in this process because many of those petrochemical factories are involved in plastics production. So they're very involved and calling for their complete participation in creating this kind of policy and restricting the production of plastics to really go upstream to stop the production of those chemical harms closer to source. Next slide, please. And so just based on these stories, based on these cases and learning about this, yeah, Dr. Waldron is amazing. And she has actually been a huge resource, and also in terms of an intellectual resource and a support, but also a big inspiration for this course that we created through the Canadian Association of Nurses for the Environment. So just based on starting to learn about, wow, look at these profound impacts from environmental policymaking that is structurally racist, resulting in these incredibly unjust health impacts for some peoples, looking at nurses' role in health equity and social justice, connecting that to environmental and climate issues, naturally, we wanted to focus on something that we could bring forward to nurses. And given Dr. Waldron's advocacy for a focus on environmental racism, so that we don't skip over this piece that sometimes environmental and climate justice discourse can miss, really focusing on racism, we decided to create this course on environmental racism for nurses. So if you haven't had a chance to check it out, you've got the QR code there, please do. This course is really based on the stories of people who either work very closely with communities experiencing environmental racism or who've experienced it themselves. So there's a number of powerful women who are featured in this course, speaking about their experiences, including Dr. Waldron and others. So I'll pass it to June to share a bit about some of their, this is my slide, isn't it, June?
Yes.
Okay. So there are 3 modules for our course. And the first module is really a little bit of what I've been talking about already. We start to lay out some of the foundations for environmental racism. And we do that again through the stories of these women. We want to build out, okay, this is how it's relevant for nurses to look at. And these are some of the health impacts, from mental health to physical health to collective and community-based health impacts.
Thanks, Alysha. So I'm going to continue by introducing you to one of the very strong contributors to the environmental races course, Dr. Deborah McGregor. She's an Anishinaabe woman from the Whitefish River First Nation, which is close to Manitoulin Island, which happens to be close to where I'm from as well. And she spoke a lot about her experience, her personal experiences with environmental problems, etc. Her research looks at environmental and water governance, environmental justice, health in the environment, climate change, and Indigenous legal traditions. And she has been a professor as well as a research chair in this area. So although she's not a nurse per se, a lot of her work has focused on health. And she's shared her personal anecdotes of when she went off to university. Before that, she was able to drink the water from the rivers near her home. Fish were eaten out of the rivers and the lakes, etc., all the time. It was in fact, she mentions that they have fish clans within her First Nations. When she came back from university, though, she was being warned, especially for childbearing women, should not be eating fish more than 3 times a week, etc., because of the mercury and other contaminants, etc. So in the course, she really talks about the connection between industrial resource extraction pollution and how that affects ecosystems, particularly water, and how it undermines the indigenous food, etc. And it's just had such a big impact on her First Nations, etc. And how, and then, adding that on to other examples and so forth. So it's really there is a video within the course that you can watch there. She's talking about this, and it's really quite powerful. Next slide, please. Another very strong, dynamic First Nations woman that is included in this course is Melania Labokum Massimo, who's a Lubicon Cree woman from Little Buffalo, Alberta, which is right at the edge of the tar sands in Alberta. She's quite well known. She was co-founder of the Indigenous Climate Action, as well as the founder of Sacred Earth Solar. She and her team worked really hard to help communities to put solar energy within it, and not only putting the energy, getting that available so that they have the energy at lower cost and cleaner, etc., but teaching the community how to do it. So building economy within it and building skills within it. And one example that she gave was in Little Buffalo, where she worked with people from all over the community to install solar powers that now serve the whole community. So she's been doing this for 20 years. In the course, she talks about the link not only between energy, etc., and the environment, but also the violence that has been nature and the earth have been feeling so much violence since colonial times, and how that's reflected with the violence against women, particularly Indigenous women, but also women of any color, gender diverse individuals, Indigenous people in general. And she'd really made a point of that. It's not just women that go missing, but also men. She made the links, and she knows that gender is a social location. And one example she gave us a lot of the work camps when extraction types of industries are going into remote areas, often are the locations where Indigenous people go missing, which is really quite distressing. So she looks at how environmental justice and racism, etc., do affect the determinants of health. and how gender-based violence is just such a big problem in so many Indigenous communities. So it's another consideration that we need to think about how environmental racism impacts the health of Indigenous and other gender and social and culturally uh, disadvantaged people that are experiencing this racism. Next slide, please.
I think that's my turn. Hey, June.
Yeah.
Yes, thanks for that. I think just in hearing you talk, it's so clear, and I'm sure most folks who are on the call are familiar with the sort of ongoing call to nurses to be more involved politically. And I think these particular issues really drive that home. We're in a place, in terms of our historical place as a country right now, where there's a lot happening with industrial resource extraction and a big push for more of that. And yet industrial resource extraction has many other impacts as well. And so being politically informed, understanding structural determinants of health, such as these, is really a role that nurses can have in terms of advocacy. I'll just plug that as a little bit of I hope, like a summary of some of this information. So we've talked about environmental racism really as the core of environmental injustice and climate injustice, not as much on the climate side, but on the environmental side. We've shared some examples, and then we've started to share a little bit about our course, CANE's, Canadian Association of Nurses for the Environment course on the topic. And so I'll just briefly mention the second module of our course. So June and I just spoke to the first module, but the second module is really where we try and make the case, make this logical link and rationalize the fact that we as nurses are committed to, through our codes of ethics, through our societal mandate, through our professional, our professional practice standards, to work for social justice and health equity. Sometimes that can seem like lip service, and we've certainly been accused of that in nursing. And yet it is something that we aspire to do. How do we do that practically? How do we really live that out, not performatively, is a good question. And so this is an ongoing challenge and something we want to make this link with. Doing work for environmental justice and climate justice it can be part of our social justice mandate and our health equity mandate. I think we'll go to the next slide. And what we would love to hear a little bit about from you, perhaps, is maybe to take a few minutes and think about how you think nurses can address environmental racism. We're going to next talk just a little bit about what environmental and climate justice are, but maybe think for yourself, what do you think nurses can do, or what can you do for environmental racism as a nurse? And it can be anything from the most broad to the most, specific. It's something that Ingrid Waldron has really encouraged nurses to get involved with, addressing environmental racism as a social determinant of health or a structural determinant of health. So I'll give you a few minutes just to think on that. Yeah, absolutely. Incorporating into education is really key. Yes, that's awesome. Learning about it, educating others, and then uplifting the voices of people who've experienced it. Absolutely. We really have intended our course to do that, but this is very much ongoing work. Learning from folks who are leading in environmental justice work. Absolutely. I think as nurses across the country, you know, we work from the most remote communities to the most urban. We really work in all places, all geographies across the country and around the world. We're such a numerous health force. Of course, we encounter people that experience environmental racism and environmental climate injustice. It might not be called that in terms of when we do encounter it, but we certainly do. Why don't we go to the next slide, Ankur? Awesome, thank you. So we wanted to ground that conversation in environmental racism as the core of environmental injustice, but let's talk a little bit about environmental and climate justice. So the environmental justice movement came about and emerged in the 80s in the southern US, and it was led primarily by African-American activists who were protesting a PCB landfill. There was, you know, many allies within that work, but really this has been led by folks of color. Environmental justice is about the right of all people to live in a safe and healthy environment. It's about ensuring that no community or group of people bears a disproportionate burden of environmental hazards or pollution. It's about the fair treatment and meaningful involvement of individuals, families, communities, and others, regardless of race, gender, income, or other factors in the development, implementation, and enforcement of environmental laws and regulations. So it's really about inclusion. It also includes these different 4 dimensions, and probably the conversation has really expanded around these dimensions of justice. We hear of different ones as well in this space, but these 4 primarily are distributive justice. So that has to do with the fair sharing of environmental benefits and burdens. Procedural justice, which is really about fair and inclusive decision-making. So some of these points already made. Corrective justice, which is about accountability and repair for environmental and climate harms. And then social justice, which is about social, economic, and political conditions that allow people to live healthy, dignified lives, that give them opportunities for health and social opportunities. Next slide, please.
So this is a wonderful visual representation of Indigenous environmental justice. This was recorded, or sorry, it was snapped, I guess, in Burnaby, BC, which is right adjacent to Vancouver, in a mass protest against the Trans Mountain / Kinder Morgan pipeline expansion that occurred a few years back. It shows just the amazing power that people getting together can bring. And at the forefront, there was a number of Indigenous leaders and hereditary chiefs, including Chief Stuart Phillip, you can see on the left, etc. And it gives a great backdrop to a number of Indigenous environmental justice movements that are happening, which brings me back to Dr. Deborah McGregor, who again really focused a lot of her career on Indigenous environmental justice. She reminds us that environmental justice is a concept that has always been within the Indigenous worldview, and it's based on the sense of relationship with the land, relationship with all beings that live on the land, and so forth, and a sense of responsibility for protecting and being stewards of the land to protect those beings and so forth in all parts of the earth. So she's basically focuses on the core of how Indigenous people understand that their obligations and responsibilities do pertain to the natural world, and encourages all people of all races to connect with this. And to know that we don't have a right to degrade nature. Nature has its own rules and responsibilities, and it's been taking care of our species for millennia. And one example that she gave us is in relation to water. And so I'm going to quote her. She says, "I don't have the right to degrade water or contaminate water or pollute water, because if I do, I violated the rights of water to fulfill its own responsibilities to support life, not just for people, but for life, aquatic life, and fish, etc. And when I do that, and if I drink contaminated water, so if I've hurt that water will harm me because I didn't respect it. And we are facing that in many areas. Many Indigenous communities are still struggling with impure water. And so these are her words from the course. So it's in the course that we've been talking about. Um, she talks about how environmental justice is not just a binary concept, but actually a concept of relationship, responsibility, respect, and reciprocity with nature and other than human beings. So that we have a real strong need for land back. That is a very strong concept in environmental justice. It's critical to Indigenous people living with the responsibility of their own environment, etc. It helps to reduce the harms of colonization by putting the land back, by allowing that stewardship to happen again, etc. It makes a really essential part of Indigenous climate justice and environmental justice. So next slide, please.
Thank you, June, for sharing about that. It's really it's a fundamentally different a way of seeing the world. When you think about water actually has responsibilities itself that is impeded from being able to meet. That's a multi-species justice frame. So thank you for bringing that Indigenous ways of knowing. So really briefly, if you want to check out sites of environmental injustice and justice around the world, you can check out the Global Atlas of Environmental Justice. There's the QR code there, and we're happy to follow up if you want the website or whatnot, but there it is, an awesome resource. Next slide, please. So climate justice is really a sort of emerging out of the environmental justice movement. I sort of think of environmental justice as a bit of an umbrella for climate justice. Climate justice, of course, is really focused on equity and human rights in the context of climate change. It requires attention to gender, race, class, ethnic disability, and intergenerational equity. And it's all about it's at least a good part of it about a just transition for workers and communities as well. This is part of it. That intergenerational piece is so fundamental as well. If you think about Fridays for Future, I think that's what the movement was called. Youth and school children and school youth around the world protesting lack of government action on climate change. Really, that was a youth-led climate justice movement. It has been. Next slide, please. This is another awesome resource for you to check out, the Climate Atlas of Canada. There is much here for you to look at, including there's very much a strong inclusion of Indigenous perspectives in the context of climate change. A great resource to check out, very strong justice dimensions as well, including disability justice dimensions. So the disproportionate impact of climate change on folks with disabilities or chronic illness, that's included in this atlas. And again, we can follow up and share our resources with you to check this out. Next slide.
All right. This is where I'll be taking over a little bit here. And with the context and understanding the lens that June and Alysha have provided, we're gonna dive through a little bit of an understanding of my province, the province of British Columbia, and how the impacts of industry have kind of pervaded throughout our region. So I'm showing you this map, environmental racism in British Columbia. When you look at it, we see the legend below. Those who have low counts of pollution and the geographic area are shaded in blue, while we see high counts of pollution in the region shaded as red. So what you really know, what's really striking about this map is the large density of industry and pollution in our northern regions. And when we consider this from a social and environmental lens, why would we see this? Why do we see a large density in our northern regions? And one of the reasons is because these are lands which are primarily inhabited and stewarded by indigenous people for millennia. These are lands in which indigenous groups and representatives have prevented overabundance of resource extraction and land usage in the region. So as our province and our federal picture shifts to geopolitical conflicts, as Alysha was mentioning earlier, we see a more rampant utilization of our land and a harder push for industrial development. And really, what does this mean for these communities? This means higher impacts of pollution. June said this so vividly earlier. To be an indigenous scholar living with the land, learning with the land, and really coexisting to subsist with your meals and your water come directly from the land and to go off, attain an education, and to come back only to feel that the place you once knew has changed, it's shifted. There are industries polluting the land, and you can no longer exist in the way that you have been existing prior, and the way that generations have done so for millennia. So this is a ongoing picture in BC, and I think it's really important to situate that in our provincial understanding. I want to zoom in a little bit more from here. So I want to talk about my hometown of Kitimat. So I took this picture this past summer, and it's a beautiful photo. This photo was taken on Heisel Hill, the land which or an area of our town which is named after the indigenous people who have stewarded this land for generations, right? And to kind of discuss this photo a little bit, you can see our town nestled in the bottom left corner, or bottom right corner, covered by some trees. And you can see the broad expanse of forest, the beautiful mountain range. And you know, when I see this picture, every time it brings a large sense of joy. I have a lot of pride living in this community. But something that's quite interesting about our community is we are actually home to the largest private investment in the history of Canada to a tune of $40 billion. And this is industry which is entering our region. So this is the work of LNG Canada, which is a methane liquefaction plant. So to kind of paint the picture on how industry rolled up into our town, we have methane fracking, which is happening in Northeast BC. You could see a large picture of that up in the map prior. And this methane gas, which is fracked, is brought about 600 kilometers across the province via the Canadian Gas Lake or Coastal GasLink pipeline to my hometown, my backyard in Kitimat. And what's very interesting about the system is that it's an open system. When you're bringing gas across a province, you could only imagine the high amounts of pressure to make this subsist and to make this project work. And what happens with the system is when you have this high amount of this pressure needs to be released in some circumstance. And this gas is actually burnt off directly into my community in a process known as flaring. So I provided this photo here, and I want to play a small game to see if you can tell the difference between these two slides. So here, we'll move onwards. And I'm not sure if you can notice it, but just in the back of that beautiful mountain range, you can see a large metal tower with a burning flame and black smoke emitting right into our airshed. So this is an interesting picture. This is something our residents call the Eye of Sauron, and this is the flare in our backyard. And what's important to understand from a nursing perspective or healthcare perspective is this is directly impacting our airshed, our community cohesion, and really the entire workway of life for our community members. So let's dig into this. What's the impact? Imagine you're living in Kitimat as a community member, and to put that environmental justice lens on, imagine you are living as a part of very many equity denied groups, whether you're a member of our Indigenous population, a member of our older adult community, or those facing certain comorbidities, which really change the way that you perceive the environment around you. I want you to try and imagine living in a community where this is your air, where you have a booming, loud noise which can shake houses in your community, trying to sleep as perhaps a worker there. Imagine the light sky just completely lit up when you're trying to sleep, and how that may impact your way of living and the the functioning of the wildlife around you, which you have persisted on for generations, how it impacts their water and your land systems. Going back, what is this doing to our water cycle? How is this entering our wildlife? How is this affecting our agriculture? What picture does that paint? And, as healthcare professionals, how is this affecting our healthcare system? You know, we're working in a system that is already overburdened and overutilized. How can this exacerbate the issues that we're already seeing, right? And let's dig back into this. Who feels this the most? And as healthcare professionals, we know our vulnerable populations. We know how Indigenous communities have faced environmental dispossession and how that reverberates throughout their health outcomes. We know the impacts of age, let's say the spectrum from our youngest to our oldest. Our babies who are having their respiratory systems developing, our oldest who have frail lungs and difficulties adapting to situations. Think of gender, those who are birthing parents. How does this affect your maternal outcomes? What I've personally noticed as a healthcare provider in the region is people are feeling that they're directly facing impacts in the face of this flaring. They're reporting that they're having more coughing, more difficulty breathing, respiratory irritation. And this is particularly in those who are already facing long-term conditions like COPD and asthma. What does this do for outcomes in my region? And what I want to talk to you about a little bit today is what can we do as healthcare professionals? What is our role in platforming these voices to bring light the environmental justice, to actually do good cause for the region and the patients that we see on a daily? So I want to speak a little bit about the role here. So how can we respond? Communication. We hold the role of communications as, public reports have been shown that nurses are the most trusted healthcare professionals. Trust is a form of healthcare infrastructure here. So, to kind of share some of the work we've done as health professionals and Indigenous land protectors, we can start with this picture on the left here. This is a letter that we wrote alongside the Canadian Association of Physicians for the Environment and the Skeena Watershed Conservation Coalition. So, bringing together physicians and various health professionals and Indigenous land protectors. The Japanese Bank of International Cooperations is actually one of the largest funders of this project in our community. So, as Alysha brought forward earlier, it's so important to understand the policy mechanisms which bring environmental justice to life. Where is this funding coming from? Who is making these approvals, right? So, one of the main asks of this letter is to actually suspend financing until we have an appropriate understanding of what is going on in our region, till we can conduct health studies and really see a fulsome picture of the events, right? And on the photo on the right, I think it's incredibly important that our communication can be broad reaching to speak truth to the community members who are discussing their concerns with you. So we had a little bit of a news broadcast about this where I spoke about the actual impacts that residents were reporting to me and tried to share that picture on a broad scale. So communication is integral to our role as advocates and policy leaders, right? So let's move on. Policy action. That is such a key piece of the work that we do. If we can bring communication, we can make the public aware to as much as we like, really. But if we're not able to actively engage in policy making and decision making, it's hard to really cause a concrete shift in events for our community. And what I think is perhaps one of the most important areas to really challenge and make action for nurses is the local impact, the municipal government, your town government, because they wield the most proximal and daily impact into functioning in your community, right? Action at the municipal town level is perhaps the most important because it's the determinant of your daily lives. So on the left here, we have some reporting of a letter I sent to council, I believe perhaps a month ago, bringing attention the impacts that my fellow residents in the community were saying to me, and the imperative of a comprehensive health assessment to understand where we are going as a province and how this is impacting our communities. So that policy engagement is such a strong piece because as we look to the right here, we have four separate towns, four separate municipalities who are all LNG facing, which have said, okay, we have this in our backyard. This is a reality that we are currently living with, but what can we do about it? These towns have said, we need to learn more about what's going on. We need to see how our residents are being impacted, how our healthcare system is being impacted, and how we can work based off that. So since February of this year, we've had Squamish, Hazleton, Dawson Creek, and Terrace, all very proximal to LNG industries, call for a health assessment in our province. And I think that's so indicative of the work that healthcare professionals are doing. They are informing our municipalities, and our municipalities are going to the province and telling them, we need action. We need something done about this, right? So again, nursing action is the heart of this. We need to be engaged and active. So another big piece. I mean, we're talking about nursing, and it's impossible to separate our role of education. It's integral to the work we do. But what's interesting is the breadth and span of education you can do as a health professional. Our work doesn't end at clinical practice. It has to expand throughout communities and across policy tables. So you see some wonderful photos here. This was in collaboration with some other nonprofits and charities. So we worked with My Seat to Sky, the Canadian Association of Physicians for the Environment, and the Laxip Firekeepers, who are Indigenous land protectors, to host community town halls across this province. So far, we've had two events, one in Squamish and one in Vancouver. And really, we intended to bring together community members, families, local decision makers, Indigenous representatives to discuss this issue as a community. Squamish is facing their LNG industry. Vancouver has Tilbury in their backyard. So it's so important to educate community members about what's actually going on, to provide a fulsome picture of the impact in the region, and to see how they can engage in more efforts to really understand their baseline health profile and see how they can safeguard the health of their community members. So education is such an important piece here. And then I want to end it off with perhaps one of the most important roles that we hold is research and monitoring. As industry proliferates our communities, we need to understand both the baseline community health and environmental status. Without appropriate measurements of our current status, we can't really see how impacts can deviate from projects, right? So provincially, the push for a cumulative health impact assessment for the LNG industry is still ongoing. Health professionals across our province are still pushing this envelope. But as our work moves forward in the region, we're already seeing small scale research being done to, you know, put together some patchwork of understanding of where we're at and how this industry can impact us. As Alysha brought up prior, the impact of benzene. This was such a large impact for the Amjinang nation, but we don't have benzene monitors with a industry like in Kitimat. We don't have benzene monitors, and flaring is actually something that produces benzene in our region. And BC Gas has been known to have higher than average amounts of benzene. So we need to push for these environmental safeguards, these environmental standards, so we can understand at a baseline what is going on. And that's just a small piece. It's a piece that I can ascribe to you in the 15 minutes of for the role of nurses in our policy engagements and our education and our communication and research. But the breadth is so expansive of the work we can do. And I think because I am perfectly hitting time here, that might be where we end the presentation. But thank you everyone for attending today. I'll pass off to Alysha here.
Sounds good, Ankur. Thank you so much for providing such a clear examples of the potential role of nurses in policy and political space, community education spaces. Just phenomenal to hear about your work. I really want a huge kudos to you. Thank you so much. Please get a hold of us if you want to join in our work at CANE. If you're not already, we would love to have you join us. And we've got a number of committees. You could join our education committee, our environmental justice committee, where we can, think together on how we can get up to addressing these issues and engaging with these issues. Of course, our environmental racism course is out there for you to take or share with your students if you're an educator, clinical educator. But we really appreciate you joining us today. June, can I hand it to you to close things off?
Well, again, I just want to reiterate what both Alysha and Ankur have said. We really appreciate you being here and sharing this rather heavy topic, and yet it in the three of our hearts, we really feel that it's an important topic and we feel quite passionate about it. And I think, again, as Alysha said, she and I co-lead the Environmental Justice and Racism Committee. We would really appreciate it if you would join us. If you're a CANE member, please do contact us. Just go to the committee's page on the website. And I just want to, from the coalition perspective, I want to thank you so much for coming. We're really happy to celebrate nurses. Again, kind of a heavy topic, but an important one. So we hope you're taking away some nuggets to think about, etc., and thinking about how you can bring these into your practice. So thank you, everyone.